Good evening. My name is Obina Obilo, a board member for the Nigerian Healthcare Foundation, one of the preeminent organizations focused on bringing healthcare to the most disadvantaged populations in Nigeria free of charge. We are so excited for you to join us during our Faces of Hope campaign throughout the month of June and hope that you have found our programming enlightening, engaging, and that you are considering supporting our organization in the future or today. We would love the support and we thank you for your engagement with our organization. Tonight, we are bringing you the first of its kind, a pitch competition involving students from across the United States who are sharing their wonderful ideas about how to implement and produce new ideas for the healthcare system. Some of these ideas are really great. We received a number of them and had a panel of judges review. And tonight we are unveiling the top three. We are excited for these three wonderful students to have the world hear more about their ideas and hopefully to be able to award scholarships to two of these students as part of this pitch campaign initiative. So without further ado, I'd like to go into the pitches. I'd like to share with you the top three ideas that have been shared by these students. We hope that you will find these ideas engaging, and we hope that at the end of this, you will be able to vote for the student or students that you believe have the best ideas. The first pitch idea comes from Danielle Metcalf from Chamberlain University in the Chamberlain University School of Nursing. Danielle is majoring in nursing, and her idea is Crown of Glory, hair care for seniors. Let's watch the pitch now.
A person's hair is like their crown of glory. It's one of the first things people see when they look at you, and it has a huge influence on the way some people feel about their beauty. Unfortunately, hair quality often deteriorates as people age and develop health issues. As a registered nurse, it's my responsibility to address my patients' physical well-being as well as their emotional well-being, which is many times affected by their appearance. While the healthcare staff try their best to keep residents at inpatient facilities looking their best, many times their abilities are limited. In an attempt to provide exceptional care for my patients, I've designed a new program called Crown Restoration that will provide free hair care for all textures and curl patterns to inpatients at both long-term and short-term care facilities like nursing homes, rehabilitation centers, and mental health facilities. Crown Restoration is a program that creates a partnership between healthcare facilities and nearby cosmetology schools that allows for higher level students to provide hair care to eligible patients at no cost in exchange for course credits. Some of the services that will be offered are haircuts, wash and sets, locks, braids, and twists. These services will be offered 2 to 3 times a week, year-round, depending on the size of the facility and the number of students participating. So while students gain experience, patients will be getting their crown of glory restored.
We hope that you enjoyed that pitch. Danielle's pitch we found to be a pitch that clearly makes the case for the link between elderly care patients and their appearance with their mental well-being. The program design is demonstrated through having local cosmetology students providing free services to seniors in order to receive course credit. This is evidence of collaborative design with benefits that allow for low costs in order to execute. There is broad appeal as the functionality of the model is evident and indicated to cover all genders and hair types. A couple of the questions and comments we'd also have for Danielle to explore further is how do you make this scalable across cosmetology schools and also elder care centers? And also, are there pilot schools and elder care centers that have already been identified? All in all, great work, Danielle, and we hope that you can see this idea through to fruition.
My name is Marianne Sebastian. I'm a nurse from the United States. I've been a nurse for more than 30 years. I came here in Nigeria through Nigerian Healthcare Foundation, which is led by Dr. Obilo.
Make sure that the water you drink, you boil it, because the henna causes the majority of the typhoid.
The main thing that we do here in the medical mission is give out medicines, give out immediate treatments to people who need it. Like if somebody get hurt immediately, we clean the wounds and then probably suture it. We also give out health teachings to the family, to the people, so they won't get sick.
The next pitch idea comes from Odudu Mbaba, a student at the Emory University, studying neuroscience and behavioral biology and anthropology and human biology. And her pitch is for a more efficient blood donor compensation program. Let's watch the pitch now.
Hello, my name is Odudu. I am a rising senior at Emory University, and I'm interested in healthcare because I'm committed to service and making a meaningful impact on my community. In response to the notable increases in medical and pharmaceutical costs, I believe that certain fields of the industry should incorporate a more efficient blood donation system that both compensates generous donors while also offering patients life-saving resources. As people schedule annual physicals and routine checkups, healthcare providers may present an option for healthy patients to give whole blood, platelets, plasma, or red cells during the time length of their doctor's visit. Based on their eligibility, patients who decide to opt into the opportunity may undergo standard procedures like being well informed about the blood donation process and going through screening tests to ensure optimal health history. This may also improve time allocation in primary care offices, as it gives the patient a task to attend to during their clinical visit. Blood tests and preliminary screening questions must be intensive and thorough in order to perform any draws and accept any donation. In addition to this, clear penalties should be in place for potential donors to understand the risks that are associated with attempting to donate blood if they are not in good health, have known autoimmune diseases, or are otherwise deemed ineligible to donate blood in compliance with current globally accepted blood donation requirements. Such disclaimers must be publicly announced and nationally administered to reduce the liability of taking and screening blood that violates health and safety standards. Hopefully, this caution discourages any false truths about current medical conditions to protect the health of blood donors as well as blood recipients. Exhaustive assessment techniques may also be used to supplement the content of the patient's physical exam to check and record additional blood health information. Physician offices may work with the government and health insurance companies to develop a specific billing code that either allows a fixed rate to be applied back to the insurance policies of the patient or to reduce the copay amount that is due after their doctor's visit as a courtesy for their service. Implementing these processes may hopefully increase the availability of blood supply, which is essential to carry out many major procedures around the nation. In the United States specifically, plasma donation centers currently allow donors to earn money through their donations, so it may be a beneficial idea to extend these practices in a more formal setting beyond the isolated establishments. Any ethical concerns may be mitigated with the fact that primary care providers have access to potential donors' medical histories, which may also be cross-referenced with the health history questionnaires before the drawings of blood to check for any abnormalities. This idea should strictly regulate blood donation processes using updated techniques and technology to eliminate any chance of contaminants and viruses while also normalizing the blood donation process and overall improving the health conditions and meeting the urgent need for blood among patients that experience trauma and other serious medical procedures. Thank you so much for your time and consideration, and I hope you enjoyed my presentation. Goodbye.
Hopefully you enjoyed that pitch. Odudu's pitch is one that clearly understands the need for increasing blood donation and articulates a time frame during ongoing doctor's visits and highlights how to fund this with kickbacks via co-pays or discounts applied to visits. The program design is complex, but Odudu provides a reasonable path to successful collection of good samples. Broad appeal for a successful model as blood donors are always needed and programs exist. That is to say that There's already a blood collection system for screening, and this appears to be something that can add on to this. Some of the questions and comments that we would have are, would this work for patients under Medicare or Medicaid? How do the stakeholders comply with HIPAA while being able to successfully punish donors who are found to donate blood in bad faith? And what if those individuals who are supposedly punished decide to sue or file grievances? Who arbitrates? All in all, great picture, Dudu. Thank you. Keep up the great work. We hope you can also see this idea through to fruition.
My name is Benjamin Dochukwu Confidence. I'm from Umuche Ezobolo, Eastern Bono local government, Imo State, here in Nigeria. I know of so many people that supposed to die far back, but because of this help since 15 years now.
This Nigeria Healthcare Program is lasted every 2 weeks or 3 weeks.
Nigeria Healthcare Foundation started since 1995, and I'm a living witness.
Even after taking care of the people from Monday to Sunday, he will cook.
In Nigeria, the health of the people is very important for development in the country, because the people are the most important part of the country.
The third and final pitch that made it to the top 3 comes from Chinyelu Ojukwu, a University of Pennsylvania student majoring in psychology, and her ideas for psychological services for immigrant youth. Please watch the pitch and enjoy.
Hi everyone, my name is Chinyelu Ojukwu. I'm a rising second year at the University of Pennsylvania, and I'm planning on majoring in psychology on a pre-med track. So I'm interested in creating a website that will provide psychological services to first generation and immigrant youth in the United States. This service would be free because psychological services are oftentimes very expensive with or without health insurance. So the reason why this service is catered to the youth is because according to the American Psychiatric Association, roughly 50% of mental illness begins at the age of 14. So there's a need to stabilize the mental health of these youth before it's too late. And also a study in 2016 showed that there were high prevalence rates of depression, anxiety, PTSD in first generation migrants, and the rise in xenophobia and hate crimes against people of color in America has made this situation worse. So this website would first ask the person seeking help what their preferred language is, and this would remove any possible language barriers. And ideally, this organization would hire different therapists and psychologists all around the world who can communicate in at least one language other than English. And this would ensure that the website is able to cater to many languages. Next, the person would fill out a questionnaire in order for the system to determine the nature of help that is needed and what the person wants to gain out of the sessions. Upon the completion of the questionnaire, the person will be provided with a list of therapists and psychologists who match their needs. Once the person chooses their therapist, the therapist would then be notified to reach out to the person and establish the time and frequency of their sessions. This innovative service would be useful to society because it would help stabilize the mental health of first generation and immigrant youth while evading any possible language and financial barriers. Thank you.
We hope that you enjoyed that pitch. Chinyelu's pitch is one that clearly understands the needs for psychological services, especially for younger teenage students, by identifying that problems for students normally occur around the age of 14. Chinyelu has also diagrammed how the program would be designed and accounts for the challenges faced by immigrant students, particularly language barriers and financial issues. The functionality of the tool is described in a way that is easy to understand for the user. Some of the questions and comments would be, given that the services are free to the user, how is the funding model to be determined? How do you remove stigmas with seeking mental health services, especially with immigrant populations? And also, consideration may be made to pick some core languages in immigrant communities to pilot this program in. All in all, this is a great pitch, and we hope that you can see this idea through to fruition.
My name is Nwachukwu Vivian. I'm from Obumwe. I have long-sightedness, but now I can read well. Sometimes when I read, water used to drop out of my eye, but now.
Aga m atachi onye bịara mbụ sị na mụ ojicha ọgwụ pai ebe abịala m ma gbara m ọgwụ pai ọhụ ma gbaa m Chineke ga-agwọ m o gwuola m na ya tụkwasịrị m obi na Chineke ga-agwọ m ndị ejikwere n'ọgwụ abịa Chineke ga-eduhe n'udo laa ezinụlọ ha ga-adịcha mma ha ga-aga n'ihu onwe nsogbu ọbụla ha ga-eme n'aha Jizọs.
On behalf of the Nigerian Healthcare Foundation, we hope that you have thoroughly enjoyed this pitch competition. This has been a dynamic opportunity for us to engage with young students and learn more about the opportunities that they see for making our world a better place. We have created a unique voting system and invite you to help us choose the winner. Please see the URL QR code that has been created. During the time frame of June 17th from 8 p.m. Eastern Time until June 23rd from 8 p.m. Eastern Time, we will be accepting votes. You can vote for your favorite pitch, with one vote being accepted per person per day. We are excited and we look forward to announcing the two $2,000 scholarship winners on June 24th at 9 p.m. immediately following our panel on Nigerian family health myths. We hope that you can join us on the 24th as well to enjoy the funny programming, but also learn the winners of this amazing scholarship opportunity. We're excited as an organization to support the growth of young students just as much as we are excited about alleviating healthcare concerns in Nigeria. With your help and with your donations, we know that we can make a difference in this world. Please visit us at nhfinc.org and learn more about our campaign, learn more about our programming, and learn more about us as an organization. Once again, on behalf of the Nigerian Healthcare Foundation, we thank you for joining us, and we look forward to you engaging with this pitch competition, as well as engaging with our organization. Thank you, stay blessed, and have a great evening.